Hi, Shirley. Hi, Darren. Hi, Daria. How have you been? How's your first year as a registered nurse going?
Hi, Helen. Well, I have been in the graduate program for about 6 months now. I am just starting to feel as though I'm finding my feet, but sometimes I still feel a bit lost, and at times I do wonder if I am not working outside of my scope of practice. This happens mostly on evening and night shift when there aren't a lot of people around to ask for help or advice. I remember we were taught at uni about it being our one responsibility to provide safe care and to not work outside of our scope of practice no matter what. But sometimes it's really difficult. Like last week, I was on a night shift and a patient's nasogastric tube had come out. I knew that it had to be reinserted, but apart from in the clinical practice sessions and watching a couple on the ward, I hadn't done one before, and there was no one to help me, so I just did it. I think the patient was okay, but I know that that is not good practice, but what else do I do? I am worried about being accountable for doing the wrong thing.
Yes, Shirley, I'm finding similar things. Finding the support you need on the evenings and night shift can be difficult, and I've found that at times the skill mix is just wrong. One day during report, I counted 5 senior RNs on the morning shift, but apart from the team leader, who was a second year RN, and we were the only other RNs on the PM shift. It was pretty scary stuff. And because the team leader was so busy, I was constantly checking myself, so I got behind in my work. It didn't help that we had patients coming back from theatre. The team leader said that I had to get them all as she didn't want to leave me alone on the floor in case the double ENs needed close supervision with the delegated tasks that I was not able to do. This didn't make me feel any better. It kept ringing in my head. Whatever happens here, you're not just responsible, you are accountable as well. I must say that I felt a bit overwhelmed.
Oh, delegation. It's my greatest headache. I know that delegating tasks to others can really help me as a graduate to learn and focus on registered nurse work, but I really struggle with deciding what tasks to delegate and who to delegate them to. I worry that the EENs think that I'm just lazy and trying to get rid of the jobs that I don't want to do. Then I see the other RNs delegating, but I don't think they're really making sure that the person they delegate to understands the task, nor they appear to be supervising or supporting them. Last week, a patient fell in the shower. The assistant in nursing doing the shower hadn't realized that the patient always needed someone with them and went back into the ward area to make the bed. So while I'm also constantly aware that I have a responsibility to delegate, and I know that it will help me keep up with my work, the concern that I'm accountable if anything goes wrong really worries me.
Thanks, everyone. I know that it is tough when what happens in the clinical area does not always meet your expectations, but it is great that you are aware of the difficulties so that you can work towards finding ways to improve the working environment. Just be sure that you work within your codes of practice and standard guidelines. This will give you direction and reassure you that you are meeting best practice principles. This is an exciting time for you, and it's really helpful to hear your experiences as a graduate nurse.